Most people have often heard the term appendicitis, but are not sure exactly what it is or what to do if you suspect your child may be suffering from it. Today, we'll teach you what it is, what the symptoms are, and what to do if you're fearful your child may have appendicitis. According to Stanford Children's Health, appendicitis is the most common reason for a child to need emergency surgery, and it affects 7% of Americans. The average age of children who experience appendicitis is 10 years old, although it can occur in teens and even people into their 20s. A lot of people ask themselves, what is the appendix even used for? What is its purpose? Well, the answer is, unfortunately, health experts still are not sure. The appendix is a small structure located in the bottom right corner of the abdomen, and it's attached to the large intestine. Appendicitis happens when an object, such as a piece of stool or a foreign object, blocks the flow. It's also caused by swelling due to an infection. This causes bacteria to enter the wall of the appendix, which in turn causes more damage. So now that we've gone over what appendicitis is, let's go over some of the signs and symptoms and how you can recognize this in your child. The most common symptoms of appendicitis are abdominal pain, fever, and vomiting. Pain usually begins in the area near the belly button and eventually appears in the right lower portion of the abdomen. After the abdominal pain begins, children may lose their appetite, have diarrhea or constipation, and may develop rapid breathing. The abdomen may appear swollen and bloated, especially in children younger than 2 years old. Unfortunately, appendicitis may be difficult to diagnose because it's often mistaken for regular abdominal pain. In order for your physician to properly diagnose your child, you can expect the physician to perform a physical exam, draw blood work for analysis, and they may do an ultrasound or a CT scan of the area to confirm appendicitis. Once a physician diagnoses your child with appendicitis, it's considered a medical emergency, and the most common form of treatment is surgery. Early treatment is important to avoid complications. If the appendix is surgically removed, you can expect a hospital stay for your child of 2 to 3 days. Each individual case will vary, and in some cases, it can simply be treated with antibiotics. Your physician will discuss specific treatment options that are directed towards your child specifically. If you suspect that your child may be suffering from appendicitis, it's important to contact the physician immediately or bring your child to the emergency room. It's vital that appendicitis is diagnosed quickly to avoid complications such as bursting or spreading of infection. In addition, make sure not to give your child any pain relievers such as Tylenol or Motrin, as it can mask some of the symptoms of appendicitis. It's also important not to give them anything to eat or drink, even if they ask, as they will need to have an empty stomach for surgery. When in doubt, you can always call your pediatrician or physician's office for guidance on what to do. As always, if you suspect your child may be suffering from something or is showing any of the signs and symptoms of appendicitis, it's important to discuss the matter with your child's pediatrician. We hope you find this information regarding appendicitis informative and understand it is not meant to diagnose or give any medical advice. This video was specially made for Project Access by SJVC nursing students in 2020.